What tests are used to diagnose stress incontinence? Imagine trying to find out why you suddenly leak urine when you cough or laugh. That's where medical tests come in to help doctors understand what's going on. Stress incontinence is a common issue where urine escapes during activities that increase pressure inside your abdomen. To diagnose it accurately, healthcare providers use a combination of tests, starting with a detailed medical history and physical exam. They ask about how often you leak, what triggers it, your fluid intake, and any past surgeries or childbirth history. During the physical exam, especially for women, the doctor may check for pelvic organ prolapse or muscle weakness that could affect bladder support. They might also examine vaginal tissues, especially if you are postmenopausal, since changes in estrogen can impact bladder function. One of the key tests is the cough stress test. For this, you will need a full bladder. The doctor asks you to lie down and cough forcefully while they watch for urine leakage. If no leakage occurs lying down, they may repeat the test while you stand up, as standing can make leakage more noticeable. If urine leaks when you cough and stops when you stop coughing, it confirms stress incontinence. This test is simple, quick, and usually done in the doctor's office. However, if results are unclear, additional tests may be needed. Keeping a bladder diary is another helpful step. You record when you drink fluids, urinate, and experience leaks. This helps the doctor see patterns and distinguish stress incontinence from other types, like urge incontinence, where the urge to urinate is sudden and intense. To further evaluate bladder function, a postvoid residual measurement may be performed. After you urinate, the doctor measures how much urine remains in your bladder using ultrasound or a small catheter. If a lot of urine stays in the bladder, it might suggest incomplete emptying, which can mimic or contribute to incontinence. For more complex cases, or before considering surgery, urodynamic testing might be recommended. These tests assess how well your bladder and urethra are working together. They include cystometry, which measures how much the bladder can hold and how it behaves when full, and uroflowmetry, which records the flow rate and volume of urine. Leak point pressure measurement can also be done to determine the pressure at which urine leaks during increased abdominal pressure. These tests are more invasive and usually reserved for cases where initial assessments do not give a clear picture. Sometimes, additional evaluations like cystoscopy or imaging studies are used to rule out other causes of urinary symptoms. Cystoscopy involves inserting a small scope into the bladder to look for abnormalities, stones, or tumors. Imaging tests such as ultrasound, X-ray, or CT scans can help identify structural issues or bladder problems. While bladder cancer is not a common cause of stress incontinence, these tests ensure that other serious conditions are not overlooked. Maintaining good bladder health involves regular checkups, especially if your symptoms change or worsen. If you notice blood in your urine, pain, or significant changes in urination, it's important to see a healthcare professional. Early diagnosis helps ensure you get the right treatment and rules out other conditions, including those related to bladder health or cancer. Remember, each person's situation is unique, so personalized medical advice is always best. In summary, diagnosing stress incontinence involves a careful combination of medical history, physical exams, simple office tests like the cough stress test, bladder diaries, and sometimes more detailed urodynamic or imaging studies. These steps help doctors identify the exact cause of your symptoms and guide effective treatment options. Always consult with a healthcare professional for an accurate diagnosis and tailored care.